The sun rose over the white walls of Memphis, the beating heart of ancient Egypt. Around 2667 BCE, in this city sacred to Ptah, the god of craftsmen and creation, a child was born who would one day defy the limits of human skill. His name was Imhotep. In the bustle of the capital, where priests performed rituals before towering temples and scribes inked the day's records onto papyrus, no one could have guessed that this child would grow to shape the worlds of architecture, medicine, and even the divine. Imhotep's life would span the reigns of kings, serving as vizier, chief physician, high priest, and a master builder of the pyramids. His mind moved easily between stone and bone, between the laws of geometry and the mysteries of the human body. And centuries after his death, his name would be spoken not as that of a man, but of a god. Though the details of his early years are lost to history, we can imagine young Imhotep walking through the colonnades of Memphis's temple schools, learning from the priests of Ptah. These were not ordinary teachers, they were the keepers of Egypt's deepest knowledge: mathematics, astronomy, religious law, and healing arts. His titles in later life, High Priest of Heliopolis and Son of Ptah, hint at this rigorous education. In an age when the line between magic and medicine was thin, Imhotep's approach would be revolutionary. Imhotep first entered history's spotlight not as a physician, but as an architect. In Saqqara, just west of Memphis, he designed something the world had never seen before: the step pyramid of Djoser. 6 tiers of stone rising from the desert, it was the first monumental structure built entirely from cut limestone. This was more than a tomb. It was a statement that the pharaoh's power reached toward the heavens. The precision required to build it mirrored the precision Imhotep would later bring to surgery. Yet Imhotep's genius was not confined to stone. His other, quieter masterpiece was a body of medical knowledge that would endure for millennia. Tradition credits him as the author, or at least the inspiration, behind the Edwin Smith Surgical Papyrus, a text unlike any other in ancient Egypt. Written centuries later, around 1600 BCE, the papyrus is believed to be a copy of his original teachings. It is the earliest known surgical manual in history. 48 detailed case studies arranged with a clarity that feels startlingly modern. Where other Egyptian medical papyri were heavy with spells and incantations, this text relied mostly on observation, logic, and practical treatment. Each case followed a methodical structure: title naming the injury, examination, what the healer saw and felt, diagnosis, a clear statement of the condition, prognosis, the likely outcome, treatment, step-by-step care. Imhotep's approach was empirical. He classified cases into 3 categories: an ailment I will treat, full recovery expected; an ailment with which I will contend, uncertain outcome; an ailment not to be treated, terminal. This was more than medical writing. It was an early form of medical ethics. Much of the papyrus deals with trauma, injuries from accidents or warfare. Fractures, dislocations, cuts, and crushed bones are recorded with chilling detail. The text includes suturing of wounds, including lips and throat, bandaging and splinting of limbs, the use of honey and even moldy bread to prevent infection. An early form of antibacterial treatment, raw meat applied to stop bleeding. Immobilization for spinal and head injuries. For nasal fractures, the papyrus describes closed reduction using linen plugs soaked in grease, and even early reconstructive techniques involving stitching and specialized dressings. These may be the first recorded instances of reconstructive surgery. Imhotep's surgical notes reveal anatomical insights that would not be rediscovered in the Western world for over 2,000 years. The papyrus contains the first known descriptions of cranial sutures, the meninges, membranes around the brain, cerebrospinal fluid, the external surface of the brain, intracranial pulsations. It also records the connection between brain injury and paralysis, noting that damage on one side of the brain could affect movement on the opposite side of the body, a concept still taught in modern neurology. The papyrus names organs like the heart, liver, spleen, kidneys, and bladder. While their exact functions were not fully understood, Imhotep recognized their importance. Blood vessels were described, though some were thought to carry air or life force rather than blood. What stands out is the text's restraint in using magic. Spells appear only rarely, usually on the reverse side of the scroll. For the most part, healing was a matter of skill, not superstition. The structured case-based style of the papyrus suggests it was meant as a teaching tool, possibly for military doctors treating battlefield injuries. Nearly 100 anatomical terms appear in its pages, making it a kind of medical dictionary for ancient Egypt. Through this work, Imhotep was not just treating patients, he was training the healers of the future. Although no list of his patients survives, Imhotep's position at court as vizier and chief physician meant he likely treated Egypt's elite, including Pharaoh Djoser himself. Imagine the high priest summoned to the palace, his linen robes brushing the stone floors as he carried his surgical tools. Bronze knives, linen bandages, jars of honey and aromatic oils. Every treatment he performed would have carried the weight of national importance. When Imhotep died around 2600 BCE, his legacy did not fade. Over centuries, stories of his skill grew until he was worshipped as a god of healing, the only mortal in Egyptian history, apart from Amenhotep, son of Hapu, to be fully deified. Temples to Imhotep became centers of pilgrimage. The sick and the suffering would sleep in these sanctuaries, hoping to dream of the god who would reveal their cure. In later times, the Greeks visiting Egypt equated him with Asclepius, their own god of medicine. His cult spread and his name became a bridge between two of the ancient world's greatest civilizations. Today, Imhotep stands as one of history's earliest recorded polymaths, architect of the world's first pyramid, surgeon whose notes could still guide a doctor's hands, philosopher priest whose life blurred the line between science and the sacred. Over 4,600 years later, his work reminds us that the roots of medicine run deep into the sands of ancient Egypt, carried forward by a man who saw the human body as something that could be understood, repaired, and preserved, just like the monuments he built to last for eternity. In the shadows of the step pyramid, the desert wind whispers the name Imhotep, not just a builder of stone, but a healer of flesh, a man who measured the stars, mapped the human skull, and left behind a blueprint for the art of healing. In the story of humanity, his chapter was written in both granite and blood, and it has never been erased.